Hello, everyone, and welcome back. You are listening to the UK-US Healthcare Innovation Exchange podcast in the Centera studio at Belmont. I'm Abby Lemon-Stevens, and I'm joined by my co-host, Chase Spurlock. Joining us now, we have Shane DeGaris, Group CEO of Barts Health NHS Trust in London, one of England's largest NHS trusts.
Good to be here. Thanks for the invitation.
Yeah, so Shane, you've got an American audience who probably only knows the NHS as a headline. Tell us a little bit about your day job. What does it actually look like and how it differs from the US healthcare system?
So the NHS is essentially a fully taxpayer-funded service. So that's probably one first differential, talking to colleagues here about how systems are funded. And so we run 5 hospitals in East London, which is some of the most deprived parts of London. Very much strong health inequalities, population health issues, which are pretty much at the cornerstone of what we're trying to do. And my hospitals range from the sort of very advanced kind of world-leading cardiac and cancer centre at St Bartholomew's, special plug, which is also the oldest hospital in the UK on the same spot since 1123. Major teaching hospital and trauma centre at the Royal London, and then some more, if you like, inverted commas, normal general hospitals in New and Whipps Cross and Mile End that deal with most things that most patients need. So I guess half of my day is always trying to just make sure those things are running smoothly. Well, I've got people running my hospitals. I've got CEOs in each of my hospitals. We've got obviously nursing and senior clinical leads, doctors, etc. And so making sure things are running smoothly, that care is good, quality is good, and we're delivering value for our taxpayers in terms of financial performance. And of course, the other half is a bit more exciting. It's about the strategy, about the future, connecting to innovation. So how do we manage the demands we've got for the next 3 years, 5 years, 10 years? That's transforming how we're doing things, supporting the way the government approaches the future of healthcare.
I mean, it sounds like an easy job. You probably sleep really well at night.
Well, I think you have to sleep well. Otherwise, you could get yourself stressed unreasonably. But I've got a good team and we've got good people. And that's the main ingredient to having a relatively stress-free life.
Well, one of the reasons I'm such a big enthusiastic supporter of the Global Health Innovators Initiative in Nashville is the opportunity for two-way collaboration and to avoid having to reinvent the wheel as we're working towards very similar solutions for often the same problems. And if you think about what's going particularly well in the UK and things that, you think of as great examples of what's working, what are a few of those and what do you think that the US healthcare system could learn, from the UK and the NHS?
Yeah, absolutely. And I'll then obviously perhaps proffer some examples the other way around, because I think there's plenty. So I think one thing, because we've got a national health system, it's a bit easier to have almost like centrally controlled concepts that people just need to adopt and haven't really got an option not to. So we've got something called the NHS app, which is essentially a patient contact portal for the entire NHS. I can pull my phone out right now. I can see my GP appointment access, hospital appointments. I can change things. Admittedly, this is not wildly advanced technology. You could do this with other apps many, many years ago, but having an app that's available to all patients in the entire country is clearly a conduit that makes it far easier for us to operate as a system. That, and of course, the single data platform that emerges from all those interactions, again, enables us to look at population health and things in a way that perhaps is a little bit easier than I sense. And by the way, I've not worked in the US, so I can only go on what I sense. Perhaps a bit more fragmentation in the way some of the systems operate between the states and national and the commercial end and the Medicare, etc. If I flip that, you guys, I think in the States, and I've just seen some amazing examples in Nashville since I've been here, I think you're much, much faster at adopting innovations. You're more agile, probably taking more risks, but they're calculated risks and all done in a way that's there to really support that whole patient population and that sort of value-based approach. So agility, I think you're well ahead with us on adopting things like, say, robotic surgery. And obviously I've got lots of robotic surgery at St Bartholomew's in the Royal London.
Absolutely.
But you've been doing that at scale and pace for many years because it's not just good for patients, it's also good for the sorts of healthcare business that you guys, not you personally, but your hospitals operate in. And patients want to look at that and say, what's the sort of advantage to me as a patient? You're very good, I think, at the customer/patient experience because you've got a bit of a competitive edge between some of your hospital configurations in the way that we don't.
But we're still hoping to get rid of the clipboard orientation intake.
Good.
That's right. Repeating the information that I've already provided 6 times on
Yeah,
this.
I hate that.
Yeah.
I really do.
Yeah, absolutely. Shane, Nashville has a reputation for music, hot chicken, healthcare. Is there anything that's really striking your fancy as you're here visiting with us?
So a couple of things. We did the Country Music Museum, which I'm not a huge country music fan, but that was brilliant. I mean, it really was. Just obviously the music, but the history, how it's part of the culture of Nashville and sort of Tennessee more broadly. And then seeing, and I must admit, I didn't realize that the healthcare, Nashville was so important nationally because of the number of healthcare organizations you've got their headquarters here. And that's a huge thing.
Right.
And that blend of kind of healthcare, music, and the sort of friendly competition about who's adding more to the economy, I thought was quite interesting. And we did go for some hot chicken. I was pretty weak, went for a medium setting, which I still thought was pretty tough.
You still got some time. We're ratcheted up.
Colleagues went for the sort of double X one. I thought that's just crazy.
Sometimes it is a little bit crazy. I love it. Well, we're glad you guys are here. To close us, we're running out of time, but tell me about a moment of serendipity in your career. If you haven't heard Global Health Innovators, one of our mantras is serendipity. It doesn't happen by accident. So I'd love to hear a moment for you that really changed everything. A conversation, a connection, a wrong turn, perhaps.
I mean, I'm a physical therapist by background. And when I made the transition into management, I was one of the people that complained about management. Like, why is this place so poorly run? Why is it so disorganized, etc.? And someone said, a clever person, my boss said, well, you think you can do better. Why don't you take charge of this department as it was at the time? And I realized how difficult it was because it was all about relationships. It was about people. It wasn't really the systems. It was how we worked together as a team. So interesting for me, when I made that switch into management, that's something that's stuck with me since then about how do you get the best out of people operating in more of a kind of coaching and facilitating environment than anything that's directive, because directive I don't think really works unless it's actually a serious clinical situation or a major incident.
Incredible.
Yeah, and how do you support them along the way and during the ups and downs and kind of keep that through line of taking care of people and teamwork. Yeah, teamwork is at the heart of healthcare.
We invested a lot in kind of psychological support services during and post COVID, and we've kept them going. So staff have got people to talk to in confidence, along with talking to sort of team-based type of support networks. That and sort of talent and career development is quite important to me, particularly for people that don't look like me, because it's a bit easier for a white man in my profession to get more senior than it is for others. So I'm quite passionate about how do we make that more accessible for others and support their talent and development through the system.
Absolutely.
Shane, thank you so much for being with us today. It's been a pleasure getting to catch up with you.
Great.
I hope you enjoy the rest of your time in Nashville and Tennessee.
Thank you again. The hospitality has been amazing. Really appreciate it.
Enjoy Broadway tonight.
Thank you.
Thank you, Shane.